Hi, I'm Dr. V. I'm an interventional pain specialist and chief of the spine pain program at Bloor Pain Specialists in Toronto. But today, I'm going to be answering some common questions about low back pain and sciatica.
What kind of testing is important?
You know, this is a really common question. And the world has changed in the last 20 years with regards to information technology and the availability of reports and scans and images coming straight to the patient. So the world has really expanded in a way that wasn't there decades past. In the past, scans were always sent back directly to physicians to be interpreted. They used medical jargon so that we could get a sense from the radiologist what a picture looked like without looking at the picture. Not all of those terms are important, and different scans look for different things. So if we're thinking about getting an idea of what somebody's back looks like, we'll get an X-ray. X-rays are available very broadly and easily accessible. Now, X-rays will show us details for the bones. They will show us arthritis. They will show us the alignment of bones, and sometimes that alignment is important because the bones sometimes slide on top of each other. Our vertebrae are essentially rings of bone stacked on other rings, one on top of the other, creating a cylinder. Well, in some cases, that cylinder looks more like the Olympic sign, where somebody's bone has slid over. Sometimes that's because the ligaments are loose and there's instability, and so we can get special X-rays where there's movement. During the X-ray, we can watch bones move along each other, and that will give us information that's very different than an MRI. An MRI will show us the soft tissues. We'll see nerves, we'll see the shape of discs, we'll see if a disc has lost its contents, if something is spewed from the inside and entered the canal, or if a disc has been pushed outwards and not touching any nerves at all. In an X-ray, we can't really see those discs in detail. And in fact, neither test alone gives us everything. In some cases, to add to everything, we'll get a CAT scan. When we're thinking about a risk of things like compression fractures or problems with bone, CAT scans and X-rays see better detail than MRI. So if we're looking for information about a nerve, we're going to get an MRI. If we're looking for information about bones, like being worried about tumors or compression fractures, trauma, alignment, the shape of a fracture to see what kind of procedure can be done for that bone, we're going to get a CAT scan. You want a quick test, something that's going to show us basic anatomy or show us alignment, we're going to get an X-ray. If we want the details of the neuroanatomy, that's where we get the MRI. If you have a question that you'd like us to answer in a future video, leave a comment below. And please remember to like and subscribe.